Panic disorder (PD) is a form of anxiety disorder, characterized by recurrent, unexpected, intense panic attacks. It is characterized by feelings of intense fear, such as a racing heart, shortness of breath, dizziness, and a sense of impending death, even when there is no actual, life-threatening danger. These panic attacks typically peak within minutes and last 10 to 30 minutes, but for those who experience them, they can feel incredibly prolonged and unbearable. The cause of panic disorder is complex. It involves a complex mix of biological, psychological, and environmental factors. Common biological causes include imbalances in the brain's neurotransmitters, serotonin and norepinephrine, and hyperactivity in the amygdala. These neurophysiological abnormalities trigger an exaggerated anxiety response, causing a person to perceive danger even when there is none. Family history and genetic predisposition are also closely linked. Meanwhile, from a psychological perspective, past traumatic experiences, perfectionist tendencies, excessive stress, or repressed emotions can trigger panic disorder. The signature symptom of panic disorder is a panic attack. This is a sudden, unpredictable anxiety response, accompanied by physical symptoms such as palpitations, a feeling of a racing heart, shortness of breath, chest pain, numbness in the hands and feet, cold sweats, nausea, dizziness, and a sense of unreality. During these attacks, the sufferer is gripped by fears such as, "I feel like I'm having a heart attack," or "I feel like I'm going to die." Repeated experiences lead to anticipatory anxiety, a fear of recurring attacks, and the avoidance of places or situations where the attacks occurred. This can even lead to agoraphobia, a fear of going out altogether. Panic disorder is not simply a simple anxiety disorder. It can have a serious impact on one's overall quality of life. Social functioning at work, school, and in interpersonal relationships is impaired, and symptoms often include depression, alcohol dependence, and sleep disturbances. However, this disorder is highly treatable. The core of treatment is a combination of medication and cognitive behavioral therapy (CBT). Medication primarily uses antidepressants, especially SSRIs, and anti-anxiety medications to balance neurotransmitters and alleviate excessive physical reactions. Cognitive behavioral therapy helps patients recognize that panic attacks are not life-threatening, corrects negative thoughts that trigger anxiety, and manages hypersensitivity to physical sensations. Non-pharmacological treatments such as meditation, breathing exercises, exercise, and regular sleep have also been shown to be effective. Breathing control, in particular, plays a crucial role in reducing anxiety symptoms caused by hyperventilation. Furthermore, caffeine, nicotine, and alcohol can worsen panic attacks and should be avoided. In other words, panic disorder is not a shameful illness, but rather a treatable expression of anxiety that can occur in anyone amidst the excessive tension and anxiety of modern life.